This is video history from the J. Bay Jacobs Library for the History of Obstetrics and Gynecology in America at the college. My guest today, in this fine May morning in 1988 in Boston, is Dr. Sprague Gardiner, 23rd President of the college. Sprague, delighted we have the chance to talk today.
Nice to be here, Warren.
Sprague, there are lots of things we'd like to talk about your long, almost legendary, I guess, career, but begin by telling us where you came from.
I was born in Toledo, Ohio, the son of a physician. My uncle was a physician, my grandfather was a physician, so I was a third member of the third generation, and I thought of nothing but going to be a doctor. And my dad did OB/GYN, so I was going to be an obstetrician gynecologist.
Your father was a practitioner in Toledo?
He was a OB/GYN. He's one of the earlier men to be certified by the American Board.
And you grew up and went to school where?
I grew up and went to school in Toledo, Ohio, Scott High School, and then University of Toledo for 2 years because my older brother died and I wanted to be home. Then I went for 2 years to Michigan to get my AB degree in 1930 and then the MD degree in 1934.
And residency training?
I had an interesting time with that because I had done some work with Dr. Albert Moore Barrett, who was the professor of psychiatry. I was interested in psychiatry, and I was interested in surgery, and I'd written a couple papers in general surgery, and then I'd also written several papers with Norm Kretschmar in the Department of OB/GYN, so I had 3 residencies offered. I took OB because I brought all 3 of them together. So I took 3 years of the regular rotating internship, and then 3 years of OB/GYN, and then stayed on there for a couple of years until 1939. After that, I got a Rockefeller Fellowship and went to Johns Hopkins and studied psychiatry for 3 years after that.
Now, I know you were involved in both those careers in World War II. Tell us something about that.
Well, in the Army, they didn't know obstetricians and gynecologists. This was during World War II. And the option was either to be a third man on the bone and joint team or to be a registrar. And I thought it was much more fun to take care of patients. And so they assigned me to, I'd had 3 years of neuropsychiatry at Johns Hopkins. And so they assigned me to psychiatry. So I had 4 years of being head of a large neuropsychiatric section in the Army from 42 to 46.
And you're board certified in psychiatry, are you not?
Yeah, and I had my board certification in OB/GYN in 41. Then I went ahead in 44 and got my boards in psychiatry. And at one time they asked me they said I couldn't have 2 boards, and I said, take the psychiatry back if you don't like it. Because I was going to do obstetrics and gynecology, and I thought that the idea of psychiatry was to train physicians to do good work in taking good care of patients. And if that was conflicting for me to take good care of good patients, why, then I would give them back the certificate. I never gave it back, they never asked for it.
What direction did your career take then after the war?
After the war, I went to Indianapolis because the last couple of years I was head of the neuropsychiatric section at Fort George T. Robinson in Indianapolis. Dr. Carl Huber, who was one of my teachers at Michigan, was there at the time, and he was head of the OB/GYN department at Indiana University, and he talked me into staying because my wife and I both liked Indianapolis, so I stayed and went into private, but I wanted to get in private practice. For 12 years I'd been living off somebody else's income, and I never had actually collected any money from a patient by seeing patient as a private patient, so I went into the marketplace for some 10 years, and then after that I figured I'd been in the marketplace long enough, and I went back to the university in 57 on a geographical full-time basis at IU, and I've been there ever since until I retired in 81.
A long career in Indianapolis, indeed.
Right, and a happy one.
The college, of course, was founded in 1952. When did you get involved?
From the very beginning, because Carl Huber was the second president,
right,
and he was involved, and I was the section chairman that organized the membership within Indiana for the first 2 years, in 52 and 54. Then in 59, I was selected as assistant secretary, and I was assistant secretary of the college until 64. From 59 to 64, and then from 64 to 71, I was the treasurer, and then from 71 I became president-elect. In 72 and 73, I served as president.
Sprague, in the year that you were president of the college, and certainly around that time, the thing that perhaps you're still remembered for was beginning the involvement at the section or the state level activity. Could you tell us about that?
Yes, that all came about because in 1967 I was appointed to the Maternal and Child Care Committee of the AMA, and Harold Morgan, a fellow of the college, was chairman at that time. And during the time I was on that committee, up until 1972, we had a number of conferences, regional conferences, in which we invited various people from the states, according to regions, people from the State Board of Health, people from the college representing the section of the college who represent the chapters of the Academy of Pediatrics, the Academy of Family Practice, representatives of maternal and child care from the State Medical Society. And I saw how important it was that the ground level, is area where practice of OB/GYN takes place. Now, you can have national policies by a national organization, but the actual practice of medicine and the problems of practicing obstetrics and gynecology occurs at the local level. And therefore, to me, the grassroots was the foundation of the college. That's where the actual practice is taking place. Certain policies that are made off in limbo over here at the executive board of the college may be helpful in general, but that doesn't help me tomorrow taking care of this. And we have to work in the hospitals, work within the state medical associations, and that's why I felt that the organization of the section council, section group within the framework of the in obstetrics and gynecology, representing the college, should be the most active OB/GYN people and speak for obstetrics and gynecology at the section level, which is the state level.
How did you bring that about? What did you do in the course of your presidential year to get that rolling?
Well, when I went around to the various district meetings of the college, I had set up appointments with each section chairman. I took it by the district, and I had appointments that were about 45 minutes with each section chairman and vice chairman. And I had a list of questions to ask them, and I wanted to find out what they were doing. What role did they play regarding maternal and child care? What relationship did they have with the State Medical Association? What relationship did they have with the Medical Association and the House of Delegates of the State Medical Association? What relationship did they have with the Academy of Pediatrics? What relationship did they have with the Academy of Family Practice? What relationship did they have with the political action committees from the State Medical Society when it came to discussing maternal and child care and women's health conditions within the state legislature? And I found out some of them were doing something and some were doing nothing. I found that some of the section chairmen were top-flight individuals who were concerned and others couldn't care less. And one of the things we did about that was we changed the bylaws eventually so that we used to have, that each advisory council of the district would choose 2 men to run for section chairman. And hell, nobody's a good loser. And you get a patsy and a good guy. Mm-hmm. And sometimes you find that the patsy won it, and that section did nothing for 3 years.
Now that, of course, was a very important change in our bylaws because it's persisted in all our offices, and I think has contributed to. And
then next year, after the year that Keith Russell was president, he asked me to do the same thing. So I went around for 2 years then. And interviewed all the section chairmen and got the data and stimulated them to be more active at the local level, where I thought they actually should be. And because the college is as strong as the grassroots.
You probably know what you did is still carried out by the presidents. That is that each of them now, as they get around to the district meetings, schedule meetings with the section groups and are carrying on what you started. So,
that's great.
And as you say, it does have to be from the grassroots. Yeah. Sprague, another thing, perhaps both within the college and certainly outside the college, for which you're remembered and certainly which you can be immensely proud, is the work toward regionalization of perinatal care, eventuating in the landmark document toward improving the outcome of pregnancy. Tell us how all that came to pass.
Well, that came to pass when I was chairman of the Maternal and Child Care Committee of the AMA. Joe Butterfield had been working with Lipshenko out there in Denver, and they developed intensive care for the care of newborns, which increased tremendously the survival rate of these preemies and other sick babies. He had recently been to the meeting in the Canadian pediatric group, and they, with the Society of Obstetricians and Gynecologists, had worked out a statement for Canada. Mm-hmm. And he said, came back, he was a member of our committee at the time, he said, why can't we work on a statement? So I met in Denver in October of 1970 at the Brown Palace Hotel, I say with the pediatric mafia, because these were the enthusiastic neonatologists. Jerry Lacey and from Vermont, and Leo Stern from Canada, and Belton Meyer from Phoenix, and Joe Butterfield. I was the only obstetrician.
But you held your own.
Well, they were going to have it, for the newborn. I said, well, hell, just get the horse before the cart. I mean, let's take care of these high-risk mothers first. Then we take care of the newborn infants. And let's try to identify all these high-risk mothers. So we sent out a policy statement called on regionalized or community-centered intensive care of perinatal cases. And then we got that documented, which said that every hospital can't have all these things because there's not enough money to go around. So let's regionalize it, centralize it in certain hospitals in the community or in a certain region. So the sick mothers, high-risk mothers, and the high-risk newborns funnel into here, either in consultation or for care. We got that past the committee, and then we had it passed by the Board of Trustees of the AMA, and that opened up a brand new document, because here was the AMA saying they favored regional care for intensive care.
What year now?
That was 1970. 71 is when the AMA passed this as a policy statement to the AMA. Then Joe Butterfield met with people for the March of Dimes, and they felt that all kind of hospitals were asking them for money, and there's no national planning, no regional planning at all. And so Joe came to me and said, I think it'd be a good idea. The March of Dimes is interested in this. This is the day before I took over, was installed as president. This is May 2nd, 1972. Joe Butterfield came to me and said, what do you think of this idea? And I said, it's great, but these 4 organizations should organize first. Then we'll ask the March of Dimes to serve as secretariat and help us with finances. That was in May. In June, I called a meeting at the AMA meeting. At that time, I was president of the college. John Kernodle, who was an OB-GYN fellow of the college, he was chairman of the board of trustees of the AMA. Right. Jay Arena was president of the American Academy of Pediatrics, and Bob Quello was the treasurer of the. They had nobody in maternal child care for the general practice. He was interested in it, so he was the treasurer, so he came. And we then decided we'd form a committee. And so I went and I got in touch with the people from March and Dimes, with Gabe Steckel and Art Salisbury. And we then in August had a meeting in Chicago and formed this committee on perinatal health, and with these 4 organizations all represented. And we decided, and then with the March of Dimes Secretariat, to show how they were sincere about it, Harry Green, who was then chairman of the board of March of Dimes National Foundation, came and gave the blessing to this whole thing and pledged the money to support it. So that's how we got started. So in 1972, we got started on this, and took us 4 years, and then I must go back. The policies that we stated out in 71 was approved by the very organization, some with rather indifferent things, particularly the family practice group. They weren't particularly enthusiastic about it, but they went along. And then we started in 72, and for 4 years worked on this document. Got it all straightened out. And it took me, 12 times I had to appear before the Board of Trustees of the AMA to get rid of every sentence, every paragraph, every sentence, every comma. We finally got it through, and then we published. We was right for the National Foundation March of Dimes to publish it, because they could. They took the expense of publishing it. They distributed 50,000 copies of it, and they copyrighted it, and it's worked out very well.
Well, it's what now, 12 years, and people are still referring to the document and talking about it, and its tenets are being carried out. So, a real landmark achievement.
Well, I think it was fun to do it, and it took the 4 groups to do it. Now, I think all things in OB-GYN, that if you work with a group of all dedicated, interested people, you get a lot more accomplished than for us to be out in left field. And that's why I've been working with the AMA and working with them, because in the AMA, we can bring all these people. If we're out in left field someplace and we're doing a beautiful job catching all the balls, and but we can't influence what's going on in the infield very much. So I think we ought to be in the infield, in the AMA and the other things, influencing everything that happened regarding obstetrics and gynecology throughout the country.
Sprague, let me ask you finally, I know you've kept busy seeing patients and still doing things like that, but give us a view of what you're doing these days. I think maybe it's kind of a model to lots of people who are still working.
Well, when I was 71, I gave up surgery. I left the university, became professor emeritus. I did stay at the university because I felt that I'd done my thing then. There's nothing worse than having the old guy around and wondering what he thinks about this, that, and the other thing. So I left. And I went in private practice with 4 of my former residents who were young. Well, hell, I mean, they're 50, 51 years old. They're young. And I see patients 2.5 days a week. I see only my former patients. I don't see anybody under 50 because I don't want to get involved with any generation gap. I mean, I understand things and their lifestyles is something I don't understand, so I turn them over to my younger people to handle that part of it. So I'm particularly a geriatric practice of patients that I've taken care of through the years, and I sit down and chat with them a long time. Now, then I'm on several committees there in town, still with the Health and Hospital Corporation, and 3 months I spend in Florida in the wintertime with dolphin fishing at Fort Myers Beach.
Where you don't totally rest, because occasionally the college makes you do a little work there.
Well, I'm flattered to be asked to come over to have breakfast. It's a big deal to have breakfast with you. Ask me a few questions, I'm very flattered. And then I spent 3 months in my summer home up in northern Michigan.
How long have you been going up to Lake
Since
Charlevoix?
1920. And I was a 10-year-old kid when I went up there the first time. And then I do my fishing and my boating and my sailing and golfing, and we have a fine garden. And I'm so busy I don't know what to do with myself.
Sprague, it's been a long and distinguished career. I think the word legendary is not at all inappropriate.
Well, I don't know.
For our 23rd president and a real contributor, thanks for being here today.
But one more thing I want to say, and that is that I had the privilege and pleasure of sitting on a committee of 3 that chose you to be the executive director.
You should have retired sooner.
That's the best job we ever did. Thank you.
Thanks for being here today.